So in the Philippines, most of the radiotherapy cases that we see in the departments are from breast cancers, cervical malignancies, and being a head and neck radiation oncologist, majority of the patients that we see, at least in the head and neck unit, are nasopharyngeal carcinomas, which is endemic here in the Philippines. Radiotherapy can be given both as part of the curative intent treatment, like in breast cancer, in head and neck malignancies, and in cervical cancers, but we also give a lot of radiation for palliative purposes, especially in symptoms that can be localized to, say, pain, bleeding, or obstruction. In the Philippines, as I mentioned in my talk, there are only about 50 radiotherapy centers servicing a population of 120 million. There are only approximately 115, 120 radiation oncologists servicing that the entire Philippine population. So that's about one radiation oncologist per million population. And with a cancer rate of about 6 to 7 per 100,000, doing the math, we see that it is vastly underserved. Not only that, there is a majority of private and for-profit centers compared to public centers, and in a population where minimum wage is about $10 per day. It is not only access but affordability of care. I think that is a challenge to the common Philippine cancer patient. The National Health Insurance System, PhilHealth, has already covered a good percentage of radiotherapy for the everyday Filipino. And with the universal healthcare application seeing fruition in the next couple of months, then almost full coverage of the Philippine population will at least be subsidized by the National Health Insurance Program, which can shoulder about 60% minimum of out-of-pocket radiotherapy expenses. That being said, however, the added 40% in the for-profit private centers still is a big burden. So we are currently and still need to make more representations to government to make radiotherapy more accessible. There are also a good number of radiotherapy centers that are popping up, not just in the National Capital Region, but also in the surrounding islands, which I think is a good thing. And hopefully the number of radiation oncologists can catch up, because we're producing only about 10 to 15 radiation oncologists per year. And we kind of need to ramp up training, credentialing of competent radiation oncologists to service that black hole that is the need for radiation here in the Philippines. I think what the global north needs to realize is that cancer care does not center around the more expensive medications when the most basic ones cannot be accessed by a bigger percentage of the worldwide population. And applicability of what is seen in the data from first world countries, while it is nice to know, in our particular setting, it is out of reach for majority. So we need a partnership, not just with government, but with entities. And I think the global community needs to try to step in to make access to quality cancer care more equitable for more people. And that includes radiation.